Albert Einstein said that at one point that imagination was more important than knowledge. And I can't think of any place where that is more important at this moment in history than in all the issues around health and wellness. And I think we see the projected rates of growth of what's happening around healthcare. For the next 10 years, I think the consensus is roughly 6% per year, far outstripping the rate of growth of our GDP. And I think that as we look at the landscape of what we should be concerned about, obviously, right now, if you talk to, I would guess 49 out of 50 governors and the vast majority of senators and legislators, they're concerned about jobs. That would be their, given not just the state of the economy, but the vectors of momentum in the world, where we're seeing, the United States, our supremacy in the world economy seriously challenged. And for the last 60 years, there's been a level of success that we take for granted. We don't recognize that, I don't know what that, if you add it all up, how many trillions of dollars it is that has come out of our economy that allows us to live in a fashion that literally no one else in the world does. And yet within all of that, we see the rise of India, China, and more, I think even more powerfully, Turkey and Brazil, that are success at creating jobs and having those jobs generate very high qualities of life, the luxury to invest ourselves in all kinds of pursuits of happiness is seriously challenged. And if you step back and say, all right, well, jobs are going to be the large issue here, and where are the drags? What are the things that are going to keep us from focusing on jobs? What are the things that are going to really provide challenges to making sure that we continue to succeed and making sure our kids get jobs, that our businesses, that we support the entrepreneurs? I think healthcare is the single largest. If you listen to that hum in the distance, sometimes you think that's the ventilation system, but really that sucking noise is the drain on our economy from the healthcare system. I probably shouldn't say that. I'm going to get into big trouble. There's a wonderful book out that talks about jobs called The Coming Jobs War by Jim Clifton. And he lays out some graphic examples of how this country has faced these challenges before around jobs. And 35 years ago, when I was a kid, the GDP of the United States was roughly, I think it was about $3.5 billion. But you looked at the rate of growth and you looked at what Japan was doing, what Germany was doing. And when I was in school, in those years before then or after then, people continually said it's roughly going to take 25 years before Germany, and especially Japan, overcomes us. And they not only begin to outperform us, but dramatically outperform us, and the consequences. There were articles in the 70s and 80s about this on a pretty regular basis. Obviously, that didn't happen. Our economy right now is roughly $15 trillion. We're roughly 25% of the world's economy. Those projections 30 years ago thought that the rate of growth that we'd have would get us to, I think their wildest estimations were $8 trillion or $9 trillion. They thought Japan would be at 11 or 12. These days we're seeing the same kinds of projections for the relationship between India and China, that our positions will be reversed in the next 20 years. India will have, or China will have 20% or 25% of the world's GDP, and the United States will be reduced back down to a much more modest level. I think the number I saw was 8%. If we're going to address that, and I think Clifton's absolutely right. I think it's going to come down to I think federal policies will have some effect, but the real importance is going to come down to cities and counties and states in terms of how this gets implemented. And I think that healthcare is, again, that the single largest obstacle for us to be able to work out the other issues around this evolving jobs war. One of the great things, Clifton, and I'll leave Clifton alone, or at least I'll leave his book alone. One of the things that he makes a point of is that jobs aren't coming from innovation, right? We've got thousands of patents and innovations sitting on shelves gathering dust. What we're really short of is entrepreneurs. Right? You can have the greatest idea. I had a friend in college named Athan Bilius who used to tell me all the time that good ideas are a dime a dozen. It's getting them done is what makes a difference. And I think that's true around jobs and how do we make sure that we get innovators, right? We have the capability of, by the time a kid's 15, we're pretty darn clear on whether they have the potential perhaps to be an NBA or an NFL player. We know very clearly which of these kids have a high probability of becoming, IQ wizards going to Harvard or Yale or Stanford. But we have no idea of which kids have those core characteristics that are going to make great entrepreneurs, and certainly even less ways of really trying to coach them and bringing them out. Those core qualities that most entrepreneurs display, optimism, resilience, intense diligence, we don't address it in that. And again, I think that's part of the challenge in healthcare, is that we're spending so much of our time looking at, who's going to pay. If you look at the Affordable Care Act, a big part of that or the vast majority of that is really who's going to pay, rather than having the incredible sense of urgency that I feel of how do we begin to control those costs. I'll tell you an interesting anecdote. I was at a fundraiser for President Obama recently, and the woman who introduced him, who was from Durango, Colorado, some people refer to her as the underground mayor of Durango, her name's Tammy Graham, remarkable woman. And she was one of those people who would have been uncovered but for the Affordable Care Act. And she got a very, very wicked form of cancer last year and would certainly be dead now if it had not been for Affordable Care Act, or at least she believes that. And so when she did the introduction, she wrote up her remarks and sent them to the Obama campaign. This is just a brief aside that I think is interesting, because it came back. She said she wanted to say, I am someone that in all likelihood would not be standing here today, and that's why it gives me such an intense pleasure and pride to introduce to you the President of the United States, Barack Obama. If it was not for the Affordable Care Act, I wouldn't be standing here, and that's why it gives me such pride to present blah, blah, blah. And the campaign sent back and said, take out the Affordable Care Act, call it Obamacare, which I thought was a fascinating thing, that the campaign is going to take that risk of reaching out despite all the attacks on Obamacare and really embrace it. And when I look at Obamacare, and I think the parts of it that are the most revelatory aren't so much the payer models as much as building the infrastructure for how do we begin to control this incredible cost escalation that we've had. Of our GDP right now of roughly $15 billion, we have a huge chunk of that. I think it's roughly $2.5 trillion that is in healthcare, right? And it's going up at this. So the fact that it's so large means that when you look at that escalation of 6% every year, it's going to be going incredible. It's going to be growing incredibly. And I think the challenge isn't, again, by being in a country where we have this luxury of, the ability to really devote more time to and more resources to healthcare than anywhere else. To a certain extent, that's prevented us from really taking out the calipers and looking at every detail of how we're spending that money. And it's, basic facts, we can measure this. We spend roughly $8,000 per person per year in this country. And yet you can go to countries like Great Britain, or Canada, Australia, France, Germany, and they're spending, rough justice, $4,000 per person, and they're having better outcomes, right? They are able to have greater longevity. They have infant mortality is at a lower rate, and by almost all measures, their quality of life, in other words, how they go through their lives, is far better than what we have in this country. We have levels that we haven't, or issues that we haven't sufficiently addressed. The readmittances in hospitals for infections, and I'm not someone who is a disbeliever in hospitals, but if you look at the challenges we had 2 years ago, there were a couple of estimates that right around just under 100,000 people died in hospitals through medical error. Right now, that's been debated, and there's been a lot of pushback on that. But however you cut it, that's a significant number. And if we look at that projection of 6 years growing at 6%, if you sum up that, how that's going to grow, we're going to end up with a healthcare bill in 10 years of roughly $4.5 trillion. I mean, these are trillions of dollars, just so we're very clear on this. And over the course of that 10 years, we're going to have to come up with an additional $10 trillion. And frame of reference, the fighting 2 wars in Afghanistan and Iraq, again, rough justice, $200 billion a year. So people that say, well, we need to end those wars so that we have enough money for health care, the sense of scale is completely wrong. And I think what really needs to be done is to begin breaking down where are those costs. Roughly, according to the Center for Disease Control, roughly 75% of our healthcare costs are going towards, 75% of that $2.5 trillion is going to behavioral-related disease and illness. So things like diabetes, things, heart illness that are directly the result of obesity or overweight, sedentary lifestyles, things that you would think wouldn't be that difficult for us to deal with. And I think that over the next 10 years, if we've got any hope of really addressing this, we have to be much more, much bolder in how we address these issues around lifestyle and the psychological, behavioral aspects of how we live our lives, and at the same time, escalate our sense of urgency in such a way that, because this is compounding at such a rapid rate that we don't take into account what the real consequences are. In Colorado alone, we look at obesity and illnesses directly related to being overweight as rough justice costs of $1.6 billion per year. And this is a state where we are struggling on a regular basis to figure out, God, can we really afford another $8 million in our state budget for an education, a pilot program on educational reform, or whether we can generate another $60 million a year to really finish some of the bridge and roads projects that haven't been done in a long time. Colorado, just as a frame of reference, when you say the $1.6 billion, we are the leanest state in America, right? And I'm not, yeah. Well, before somebody gets injured clapping themselves on the back, I do want to point out that that's not because of any programs that we have in Colorado. Certainly it has a lot to do with the fact that so many young, outdoor-oriented people are attracted to live in Colorado because of the Rocky Mountains and the investments that many of the communities here, and Aspen's a perfect example, have made in walking trails, biking trails, really providing portals to a much more active and vital lifestyle. I think that our goal, I've been in office for 1.5 years, and we are hopefully within about 6 months of creating a plan whereby we want to transform Colorado being the leanest state to make it, without question, by maybe not every measure, but by any aggregation of measures, any combination of measures, the healthiest state. And again, as I described, as Jim Clifton said with jobs and as well with healthcare, I don't think it's going to devolve from federal policies, and they are great for foundations and great benchmarks, but the real responsibility lies with us, both in terms of municipalities and towns and cities and counties, but also in state governments, and how well we're able to weave together those different constituencies and organizations so that we can really dramatically expand our effectiveness with the same dollars. One thing that is clear is with that huge through flow, that the spend that we have on healthcare now, it's each year making it more and more difficult to get discretionary pools of money that we can put towards prevention and in terms of marketing. And that is a very, very real issue that's only going to get exaggerated if we don't accelerate our sense of or expand our sense of urgency around this issue. I think that study after study shows that your kids will do better in school if they are healthier. There are a number of studies beginning to come out now that show that if kids do aerobic activities on a regular basis, not only do they pay attention more acutely, although with a 10-year-old, paying attention acutely is not a word that I would ever put together with him. But there is a stickiness of how they retain facts and concepts when they've been exercising that is not as strong in kids that live a more sedentary lifestyle. And yet, with this incredible push that we've had on over the last 10 years for results and why is our education system failing, one thing that we're cutting out on a regular basis is phys ed and shortening recesses. If these studies are right, and I think they're enough just coming out over the next, I think literally over the next 48 months, 36 to 48 months, we will have pretty conclusive evidence. We've been making decisions that are actually hurting us on a couple different levels. Not only are they increasing the risks of healthcare costs downstream, but they're also reducing the thing they're intended to or they're hurting the solution is hurting the problem that they're trying to solve, which is trying to get kids to do better in school. I think by every measure, when we talk about my primary focus being about jobs, and Colorado's never going to be a place that we are going to offer large incentives for companies to move here. But I do think we can create an identity, a brand, that Colorado is the most pro-business state, but because it's Colorado, we're going to hold ourselves to the highest environmental standards, we're going to hold ourselves to the highest ethical standards. But in so doing and branding ourselves that way, we can be very attractive to young entrepreneurs on both coasts throughout the country as a place where they would want to come and start a business and not just build their business, but build a family and build a life. And that's never going to happen if you don't have a fairly robust solution in place for healthcare. And I think one of the hopeful things that we've seen is that there are a number of states now, Vermont I think is notable, Oregon, obviously Massachusetts is much in the news for their healthcare solutions. A number of states are beginning to experiment. What would that look like? Right? Let's put to the side for a moment what the Supreme Court's going to say in the next few weeks about Obamacare, and begin thinking about, all right, if that wasn't there, what are the other things we should be doing, and how do we marshal more resources and really focus our energies there? The last century, there's a statistic one of our staff gave me last week that scientists have been able to recognize more than 60,000 different ways the human body can fail. Right? Which I love that statistic. I mean, what an absurd, ridiculous thing to be out trying to measure. But I think what's interesting is that we have a treatment or a preventative approach for almost every single one of them, right? And yet, if you look at it, the number of people that deal with those treatments or are willing to engage and follow those treatments is de minimis, right? A fraction. And that's you run a risk if you're in elected office of saying, well, we need to all do this and pull together and take care of ourselves. And that's allegedly one step away from the nanny state in some way. And yet, I'm not sure what else is going to happen, right? I don't see any other way. Every atom of my being resists this notion of some things that Mayor Bloomberg was trying to push in New York around these, large helpings of super sweetened soft drinks. And yet, if we don't begin looking at certain things like that, the costs are going to be enormous. And I don't, the notion that that this country is going to allow hundreds of thousands of people to die miserable deaths untended is inconceivable. Somehow we're going to have to figure out some way to pay for this if we don't dramatically change the input into the healthcare system. I had dinner a few months ago with Secretary Sebelius of Health and Human Services in the federal government, and governors always have a relationship with cabinet secretaries, which is our job is to a certain extent to whine and to complain at the misery of regulations and unfairness from one state to the other. And Secretary Sebelius, who I think is, I think she was one of the best governors in the country. I think she is a remarkable, she is a gift to the community. I'm sure this room is roughly even Republican and Democrat, but whatever else you say about Obama, he has put together a remarkable cabinet of incredibly talented people that are really managing the federal government workforce as never done before. And Secretary Sebelius, we were talking, and I said, well, we kind of want to do this. We're going to need a waiver for that. We need to, here's some of these things we're trying to lay out. And we know that would put you guys in a difficult spot. And she goes, it won't put us in a difficult spot. You lay out a comprehensive, integrated plan by which you can dramatically expand coverage, where you can significantly improve outcomes, and a way that's going to control costs. We'll give you every waiver you need. We'll work through whatever needs to be done with you to make sure that kind of an approach can be replicated in state after state. And I think that's our challenge and our goal with all of you here, but certainly with states like Colorado that is small enough to be able to, you can think about it as a laboratory, as a place where we really can begin doing some of this behavioral approaches to people's lifestyles and intercepting behaviors in childhood at the earliest ages. I think if we can begin to treat Colorado and other states like Colorado as these laboratories and accelerate that sense of urgency. Is that redundant to say accelerate urgency? Maybe. Increase the sense of urgency, then perhaps there's hope. Otherwise, we're all doomed. This is a joke, just a joke. Don't want to be an elected official talking about doom and gloom. I had two budget analysts the first 2 years. We had difficult budgets, and so they referred to each other and became known throughout the administration as doom and gloom. So anyway, it isn't all doom and gloom. I think there's really nothing. We have the knowledge that's there. What we need is and it's not political will, it's the community will to make some of these investments and difficult decisions to really push hard on this. So anyway, I think the less I speak, the more time you have to ask questions, and you'll probably get more out of me answering questions from you than me, rattling off statistics. No questions, so I'm done. Okay. Oh, there's a question.
There's got to be some questions. Joe, you want to start?
I think you had his hand up first.
Okay, right here.
Yeah, thank you, Governor. If you could just speak a little bit.
Here's a mic coming up here. Thank you.
Thank you. Hi. If you could just speak a little bit to the specific challenges regarding healthcare in the low-income communities in Colorado and what you have planned to address those challenges.
Sure. Well, there are a number of different, that would take to go through the entire list of challenges within low-income communities would take more time than any of us have. Obviously, the obvious ones of just on the parental side, with so many people working 2 jobs and trying to raise a family, the ability to work out, to keep physically fit, the opportunity to cook in-home meals and not have to buy prepared foods, which are often very high in fats, starches, sugar, salt, go down the list. That's the most basic, obvious challenge. People talk a lot about food deserts, that in low-income communities it's hard to get access to fruit and vegetables that are fresh. I think the greatest challenge is that within those communities and within the culture, there is such an emphasis on survival and maintaining those jobs, generally low-paying jobs, that our efforts to build up a consciousness around what a healthy lifestyle is, we have not figured out the key. And so kids in lower income communities are much more likely, we see that again and again, to skip meals, to eat food that's less nutritious and has more fats and sugars in them. And there's an acceptance of that is, on any level, disturbing, I think, to anybody. This becomes compounded by the fact that many low-income communities, when you look at what is their proximity to healthcare, and I mean, I think that one of the really profound things that did manage to remain in Obamacare was the fact that every individual should have a medical home somewhere. Well, you look at low-income communities, it's further and further, in many cases, for them to get to a medical home. This becomes especially exaggerated in rural areas. We have large parts of Colorado where we just don't have the number of clinics and hospitals and medical personnel to deliver that medical home to all individuals. What's most challenging to me is the fact that if we are having such a difficult time dealing with the health care of the entire population, how are we going to be successful dealing with populations that already have so many steeper hills to climb and hurdles in terms of how they change their behavior than the broad cross-section of the population? Is that enough? You want more? I can keep going.
So speaking of, changing behaviors. Right now there's hi, I'm up here. So there's a political issue, as you well know, and right here we're probably pretty non-political. You're preaching to the converted, so to speak. How do we reach those people who don't understand the fact that it's not who pays for it, it's a matter of how we get people to work toward prevention? How do we convince people politically, because that's part of the problem, how do we convince them that we really have to do real prevention, real hard work in exercise, eating right, et cetera, instead of worrying about who's going to pay for what and when?
Right. Well, I went to a liberal arts school in Connecticut called Wesleyan. Thought I was going to be a writer, and I took a bunch of literature classes and creative writing. There was a teacher there named Paul Horgan who walked into class one day and he said, and I use this in connection with restaurants. I used to be in the restaurant business, but it really, I think, applies especially to this issue of how do we change behavior. He walked into class and he said, everything has been said, but not everything has been said superbly. And even if it had, everything must be said freshly again and again, right? And we have not taken on that task of how do we say this in a way that kids hear and that people in low-income communities hear it, and so that it sticks. And just because we failed a few times, we shouldn't quit. And that brings me back to my emphasis on entrepreneurship. Again, we've got most of the cures and the ideas. What we need to do is figure out a way to bring entrepreneurial energy to, entrepreneurs really are the conduit that takes ideas and capital and a workforce and creates enterprise. And I can't believe that there's not a way. We haven't found it yet, and we've got some really smart people throughout Colorado working through trying to think about how to change this entire dynamic, and what are the ways? Is it social media? Is it Facebook and YouTube? Are there ways to do it through the institutions, school districts on a statewide basis, healthcare primary providers? Is there a way to knit together first responders, right? Fire departments, right? I've never met a firefighter yet who wasn't pretty fit, at least until they got into that upper level desk job. And now I'm going to get in trouble. That was just another joke. But maybe there's a way. As our buildings, as we have less fires and our buildings are safer and more fire retardant and the firefighters have more time on their hands, shouldn't they be maybe at schools or as an extended school day? Why aren't we having athletics at all of our public schools and having firefighters be part of the conduit of making sure we have those coaches without having to raise all the money? I mean, those are the kinds of kind of out-of-the-box ideas that have popped up over the last, I don't know, 6 or 8 months. How do we turn recess so that, there's a group in Middletown, Connecticut, an organization called the Community Health Center that an old friend of mine started years and years ago, and he has a program they're trying to promote called Recess Rocks. And they're trying to get kids to dance at recess, starting from, 2nd and 3rd grade all the way through high school. But again, how do you get that done? The idea is a great idea. They haven't been able to get the complete buy-in yet. So there is no silver bullet in this, right? But we are a country that has created, I won't go into some of the travesties of what people have been induced to buy, right? I'm not going to get into pet rocks or talking ferns or any of that thing, but we can market almost anything. We should be able to market good health.
This is really more of a comment than a question, but it ties into exactly what you were just saying. And I would challenge my colleagues at the Aspen Institute and places like these to help facilitate you do your job, you and other governors. And what you've been talking about mostly here is prevention. And we know the power of prevention. It's right in front of us. We have to collect that data and make that case, because one of the huge problems with Obamacare, as we can now call it, was that it was hard to get prevention to score by the Congressional Budget Office. Right. Part of it is there are time windows, but there's other stuff out there too. A lot of this stuff actually can fit the muster of economists, and a lot of these things pay for themselves. And so when we have that data, we can go and meet with the Congressional Budget Office analysts, we do so anyway, and convince them on better models that there are some prevention things that can score. That opens up a whole new world for you, and it opens up the public-private partnerships. You're saying how to fund this, and it touches into what the former president of Costa Rica spoke about yesterday, where basically you don't have to have government paying for all of this. And that's not going to happen in a lean state like Colorado necessarily. But you can go do those where, hey, we have the data that shows this will pay for itself in 3 years or 5 years or 7 years or whatever. The data is there. Let us give it a try. You get insurance companies, and then you get venture capitalists in. And how much is government spending? Not very much.
Well, the next step from that is some of the private companies, I'm sure someone's talked about this, but Safeway, there are a number of private companies that are offering incentives to their workforce to, if they're smoking, to quit smoking, or if they're overweight, to really work on reducing that overweight, controlling their caloric intake, doing more exercise. We're working on a similar plan with state employees, which, again, given the diverse nature of all the agencies where they work and their circumstances, it's going to be a little more challenging, but all the more reason to do it and show that it works. As those programs begin to demonstrate real cost benefits, I think that's going to be some great examples on a localized level that will help people see the cost benefit. Another thing we learned when I first got elected mayor, and I opened, I used to be a geologist, and I got laid off back when our company got sold in '86, and opened a brew pub in '88. Couldn't find, I guess I wasn't that good a geologist, it turns out. But when we were first opening the restaurant, one of the things that we saw all the time was the increasing number of homeless that used to hang around downtown Denver. And so when I got elected mayor, we were one of the first cities to do a 10-year plan to end homelessness. And one of the things we saw was that the chronically homeless constitute the lion's share of the cost. A chronically homeless, someone who's been homeless more than 6 months or had multiple repeated episodes of homelessness in the previous 3 years, that their average cost in metropolitan Denver was roughly $40,000 per person per year. And a big chunk of that was healthcare costs. And these folks had mental illness, or they had addictions. Oftentimes they were emotionally fragile. They had a hard time. They'd been somehow given up. They thought that society had given up on them. If we could fight through and get an employer to give them multiple, 2 or 3 or sometimes 4 or 5 chances, they'd fall off the wagon, but they'd get to come back. All of a sudden they'd flip and become great employees, great citizens. Now, oftentimes they were dishwashers, or they were working in a call center, working for a construction firm, handling telephones. They would subsidize them with, I think $4 an hour or $5 an hour, so they could afford their apartment and stay in a place, but they had that framework, that social framework that allowed them to stay on their meds or make sure they went to counseling. And suddenly, that $4 an hour subsidy we're giving them was a fraction of what we've been, that's $8,000 a year versus what we've been spending was $40,000 a year. And I think there's some great potential when you look at some of the large costs in Medicaid. A lot of it is people that have been chronically homeless or in and out of homelessness. And by giving them a shelter and just enough support so that they get job training, we can get them into a job, that we can dramatically reduce that cost. And what we're talking to Health and Human Services, there's an agency now in Washington called the Interagency Council on Homelessness that kind of facilitates between the Veterans Administration, between HUD, between Health and Human Services. And we're trying to figure out how can we harvest those savings, which are largely in federal dollars, Medicaid, sometimes Medicare, and put them towards providing these much more minimal services that allow these folks to stay in good health. And I think we're making real progress. I think by the end of this year, we're going to have a couple contracts as pilots that are going to be able to demonstrate that we aren't just going to be doing, by the time they show up at the emergency room with, a blue arm because they've got diabetes, we're going to actually do the preventative work up front, the lighter cost social services, and be able to really measure that is a savings, and that part of that savings should go to provide those services. Famous last words.
This is a perfect question for you as a geologist. What, in terms of the water policies here, in terms of geothermal, the use for direct use geothermal, in terms of health, there's nothing more preventative than a nice warm bath. and Colorado is blessed with so many resources. What are you doing in that effort in terms of the environment, especially perhaps using these geothermal sources for health care? Is there a plan to that?
Yeah, well, when we talked about laying out those components of making Colorado the healthiest state and creating that brand, we were not ignorant of all the hot springs we have, and in many cases how underappreciated they are and undermarketed. So we certainly saw that as, one of the big issues of healthcare is tied to stress. It's not just overweight, but it's that stressful living that people at all economic levels put themselves through. And I think there's real arguments there that we could, there's some blended solutions, let's put it that way, that would allow us to incorporate hot springs or other ways of slowing people down. Meditation, right? You get into a lot of trouble as an elected official saying that there's material benefit to meditation, but study after study shows it. That if you take the time out each day and just clear your mind and using whatever technique you want, statistically you're probably going to live longer, right? It's amazing that everybody doesn't spend 20 minutes a day, but we don't. Quakers do. As my wife could tell you.
And we all know he was raised as a Quaker. I think we'll let our fearless leader here, Susie, have the last word if we could get the mic down to Susie. Fred?
Thank you. We have in our audience represented almost 40 different countries. And so I was just wondering if you might want to comment about any other countries that you might be aware of that whose healthcare system might be something to emulate.
How about almost any country? Right? I'm not sufficiently versed. There are probably other people here that can give you better detailed examples of where to look. Obviously, Europe has made, and this, I don't think it comes back just to socialized medicine or single payer. It really has to do with attitudes about healthcare and how, if you go to many of the European cities and look at how many people bicycle to work, right? Which, if it's done properly, you go to like Copenhagen, and I went some years ago, had a tour of Copenhagen and met with the retiring head of planning in Copenhagen, and he'd been a young man just joining the city when they were very early on their design on how to make a bicycle-friendly city. And we take for granted, well, that's Europe, right? They've always been into bicycles, and this is the United States, it ain't gonna happen here. Well, after World War II, in the early 50s, as automobiles became more affordable and more people drove them, they saw how congested their downtowns were becoming because they had all those narrow, medieval, winding streets. And they also saw, and this is documented back in the early 1950s, that it became a more sedentary lifestyle and it was unhealthy. And so on those two basic parameters, they started a series of 3-year and 5-year plans in Denmark where they would take, like a city like Copenhagen, would map out every 3 years, all right, for these 3 years, we're going to try and do more bike paths. And not bike paths that are right between parked cars and traffic, but they moved all the parked cars away from the curb, and then like the bicyclists ride between the curb and the parked cars. They, in every park, in every green space, they use it as a place to get bicyclists completely away from the intensity of traffic and let them have a calming, much more relaxing commute to and from work. And I don't know if you've spent any time in Copenhagen, but I've looked at the statistics. And the days I was there, it was cold and wet, kind of sleety. It was not what I would call great biking weather. It was like a really cold version of Portland. Oh, that was mean. That was terrible. I shouldn't have. I say that only because Portland has the single best biking system in America, and I'm bitterly jealous. But in Copenhagen now, they're at 40% of their commuters go in and out of work every day, and it's healthier, it's cleaner, it doesn't, I mean, all the various issues you want to care about are worked in there together. And I think those are the countries, and that's standard in Europe, standard in other various parts of Asia, not all of Asia, but in certain parts of Asia, they're beginning to really focus on that. I think one of the interesting indexes of prosperity is to look at people's happiness. And I'm sure you've all heard about Bhutan. Bhutan has a happiness poll they do every year, and they measure their elected officials on how happy people are. And the thought being that if you don't have enough to eat, and you don't have a place to live, you don't have a decent job, you're not going to be very happy. And there are a number of studies now, Gallup and a couple of other pollsters begin looking at happiness coefficients all over the world and really try to look at, where are you getting the greatest bang for the dollar? And what's fascinating is that the countries that are the happiest do not have the highest GDPs by any stretch of the imagination. The United States measures in the middle of these things, and you look at some of these countries like Mexico, has a very high happiness index. It's not our impression of how we think about Mexico. We think about the violence along the border, but that's relatively a small part of their population. Most people in Mexico love life, more so than we do, even though their GDP is probably on a per person level, I don't know, was a tenth of ours, or perhaps even less than that. So I think those are the best medical, or those countries with the best healthcare systems are also the ones that have a more integrated approach to people's pursuit of happiness, and that includes well-being. You're not going to, if you're overweight, you're never going to be as happy as someone who's in shape. And that's speaking as someone who's a very skinny person who's developed a pot belly over the last 3 or 4 years. And everyone, the hardest thing is why this is such a big challenge is how much fun is it to sit on a treadmill walking, or riding a bike in a room because you've got too much work to do. I don't know about you guys. Maybe you guys find that engaging. I think even jogging through a park is like going to see the dentist for me. I find it incredibly boring, and yet I understand how important it is, and I think that we've got to get that awareness into everybody, or else.